right, good morning, everyone. Welcome to the Swetland Seminar. My name is Linnea. I'm a project manager here at the Marianne Swetland Center for Environmental Health at Case Western Reserve University. We're located in Cleveland, Ohio. Bear with me, this mouse is a little bit slow. So if this is your first time or if you've been here before, we're glad to have you here with us virtually. Please put your name and organization you represent in the chat box if you want to share that information with others. We always like to see where people are joining us from and love to connect with people afterwards as well. So if you're not familiar with the Swetland Center, in the late 1950s, David W. Swetland and Marianne Swetland felt that not enough was understood about the unintended health consequences of chemical, agricultural, and industrial products in our environment. So they focused the Marianne Swetland Professorship of Environmental Health Sciences on preventative medicine and the threats of man-made environmental hazards so that all graduating doctors would have an interest in and understanding of the impacts of the environment on human health. For over 30 years, the Marianne Swetland Center for Environmental Health has cultivated partnerships to develop and expand solutions that enhance environmental health for everyone. Our work encompasses various exposures influencing health outcomes throughout life, such as asthma, chronic diseases, mental health, and infant vitality. We're recognized for our collaborative and adaptive approach that transcends boundaries to foster healthy environments where people thrive. And our mission is to accelerate pathways to vibrant and healthy environments through collaborative research, immersive training, and authentic community engagement. We have a three-pronged approach, which you see here in this triangle on the slide, focused on research, training and education, and community engagement. And our goal is to build capacity for the next generation of scientists to work alongside community partners to promote healthy environments for people to thrive. If you're interested in learning more about the Swetland Center and what we do, you can check out our website at case.edu/Swetland. And I'll put all these links in the chat. You can also email us at swetlandcenter@case.edu. Okay. And we do have a couple announcements of upcoming Swetland seminars. So there's not going to be a seminar in December, so we'll pick back up with the series on January 20th. Will be our first one of 2026. And the presenters, Dr. Darcy Friedman, Mamie Priestley, I believe Tracy Singer is also going to join, Dr. Owusu Yamoa, Dr. Rebecca Fishbein, and Dr. Sherry Bolin will be presenting about the Produce Path coupon program. And the registration link is on the slide, but we'll add it to the chat, and everyone will get the slides afterward as well. And then February 17th is the seminar after that. So Targeted Investment, Meaningful Engagement, or the TIME study. So Dr. Chisholm and Dr. Barnett are going to be presenting, and we'll share more details about that on our website as we get closer to those events. You can also visit our website for the full schedule. We'll be adding some more seminars for 2026 in the coming weeks. And then if you want to get more updates from Swetland on all of our projects, you can subscribe to our newsletter, The Swetland Scoop. Okay, and I'm going to turn it over to our director, Dr. Darcy Friedman, to introduce today's presenter.
Thank you, Linnea, and thank you all for being here. I want to give a special shout out to some of our advisory council members for the Swetland Center, Ivanka Hall, Lydia Harrington, and Crystal Davis, who are on here today. So thank you for being here. We're really excited to hear from our speaker today, Dr. Jahred Liddie. Dr. Liddie is a postdoctoral associate in water, Health and Opportunity Lab at the George Washington University Milken Institute School of Public Health. He received his PhD in Population Health Sciences and an MS in Environmental Health from the Harvard T.H. Chan School of Public Health. In today's seminar, Dr. Liddie will discuss geospatial approaches to estimate the sociodemographic composition of over 44,000 community water system service area boundaries in the nation. He will discuss the use of these estimates in an ongoing study to investigate sociodemographic disparities in the adoption of advancements to water treatment processes among community water systems nationwide. Then he will be zooming out and discussing improvements to the harmonization and accessibility of U.S. drinking water data for researchers and the public. So thank you, Dr. Liddie.
Yeah, thanks so much for that introduction. I'm going to share my screen now. So hopefully you're seeing the first slide of my slides and not any notes or anything.
Yep.
Yeah, so I'm really happy to be here this morning to present to all of you, and thanks to the Swetland Center for Environmental Health for inviting me to give a talk in this seminar series. So my talk today is focused on, as you heard, sociodemographic composition and barriers to water treatment in U.S. community water systems. And I want to give just a little bit of introduction to myself as well. You kind of heard a bit about me already, so I'll make this quick, but I started in undergrad in environmental engineering at Harvard. I later worked as a sustainability consultant for a few years. I primarily, in that role, worked on life cycle assessments for building and construction products. And then a few years in, I kind of decided I wanted to focus more on health outcomes and public health in general. So I went back to school in grad school and focused on public health in my master's in environmental health at the Harvard Chan School of Public Health. And then later on continued to do a PhD there. I finished earlier this year and defended in January earlier this year. And currently I'm a postdoctoral associate at George Washington University in the Water Health and Opportunity Lab, led by Cindy Hu there, focusing more on water as I continue throughout my PhD research that you'll be hearing a little bit about today. In terms of research interests, I really focus on these primary topics. So a lot of my research actually that I won't be talking about as much today is focused on per and polyfluoroalkyl substances or PFAS. I do a lot of work, as you'll hear today, on drinking water quality, exposure assessment, some work also relating to epidemiology and population health. And throughout my research, I tend to use these kinds of tools. So administrative data that you'll hear quite a bit about today, statewide sampling data, primarily for PFAS. We also use laboratory methods throughout some projects, and typically I'm unifying these kind of under a statistical and geospatial umbrella in terms of the methods that I use. So as you heard today, this talk is kind of split into three main parts. I'm going to actually start pretty detailed in the weeds, talking about these methods to estimate demographic composition of community water systems and of the customers that they serve. And then I'll talk a bit about this particular use case of those data. And at the end, I want to zoom out a bit and talk more about data availability. I think really what researchers in the quantitative space can do as we see a lot of federal regulatory attention wane to some of these issues. And so first, I want to present some work on nationwide estimates of sociodemographic composition in community water systems. And these are particular to service area boundaries. And here I actually want to begin a little bit with an interactive question that I'm curious about. I've never really asked this to an audience when presenting this information, but I am curious, particularly if you know that you aren't using a private well, and so you get your water from a public water system, which you can think of as a utility. Do you know which one it is and which region it serves generally? You don't have to say, which system that is. I don't need to know that necessarily, but if you are aware of the water system that provides you water, and you know the area that it serves. And then the second question here is whether you've ever looked into their drinking water quality reports. So have you looked up either consumer confidence reports online, or have you ever encountered other kinds of data from your water system online or in print? So feel free to just enter a short comment in the chat answering one or both of these questions. Move this down. So yes and no. I'm seeing some mix in answers. No, I should know more about it. Haven't looked into their drinking water reports. Yes, no, yes, no. So yeah, definitely a mix. tending towards no on the second question, which is definitely understandable. It's probably something that I do, maybe not most people tend to do. And then yes is, of course, for some people as well. Yeah, so that was really interesting, and I think it is an important question to keep in mind, particularly in the latter half of this presentation. And so one thing that you may not know unless you interact a lot with drinking water quality data is that past studies in the US on drinking water quality have been pretty limited by the available spatial units in terms of the boundaries and the populations that these systems are serving. So in this map, I'm sharing from a 2019 study from a collaborator detailing city and county level availability in terms of drinking water boundaries available in terms of defining the population that those systems are serving. So in many parts of the country, in the darker blue, you can see areas where both of these data are available, where you have both the city and county level reported by a system in administrative data. In other areas, you just know the county that that system is serving. Even in some areas, you know neither. And really, even when thinking about city and county level, in many cases, systems serve actually smaller geographic boundaries, or they can serve part of the county, or they can overlap between counties. And so even thinking about the data in this way, using these kinds of census statistical units is incomplete when you really want to know the population that that system is serving. And here I'm going to go into a little bit more detail on some of the specific studies available. Many of these focused on estimating and understanding disparities in drinking water quality for a range of different contaminants or for violations in general. And so many studies that we've seen, county being the most available, have used county level data to assess these disparities or to assess drinking water quality at a population scale. Some aggregating to the county level, so analyzing the data at the county level. Some not aggregated, but not necessarily accounting for clustering in the data either. Some that are not aggregated and account for clustering in terms of the community served by those systems. And then some attempting to use more detailed boundaries by either estimated or known surface area boundaries. But even then, in some cases, it can be pretty limited in terms of the scale of the data that you can analyze, in terms of the geographic breadth of data. And so some studies, when there are state-provided or known service area boundaries, they may then have to turn to other ways to link demographic data with that system, because you don't necessarily know the population that is within these more detailed boundaries. And so some have used methods like population-weighted aerial interpolation. Some just aerially interpolate, where they just weight the overlap between smaller census statistical units and surface area boundaries, and then use that to determine what that population is. And then some maybe use zip codes. They aggregate those zip codes into larger regions and then say that that is an approximated service area boundary. But as we've seen in some more recent research coming out earlier this year, that both the choice of the spatial unit, so whether that is county or city or aggregated zip codes or service area boundaries, as well as the aggregation methods. So if you're not aggregating the data, if you're analyzing it at that level of the county or city, or if you're estimating population using these different kinds of methods like aerial population-rated aerial interpolation, these can really impact results. And so it does matter the spatial scale of the data that you're analyzing, both for interpretation as well as kind of robustness for your results in terms of interpreting them. But really one of the big steps earlier this year, and I think late last year, have been these EPA data. So this is really an EPA data product that has detailed community water system service area boundaries nationwide. And so this is kind of a mix of two different approaches. In one set of approach, really the gold standard is utility or state provided service area boundaries. So these are detailed boundaries that again don't necessarily align with the city or county that a state or utility is providing EPA. So these are known boundaries, and because of that, they are the gold standard. And currently in the most recent release of these data, it has 45,000 systems total. but about 55% of those are under this gold standard with known service area boundaries. Alternative approaches, because EPA doesn't have that data available everywhere, they use either place match boundaries, typically for very small mobile home park systems, where they use imagery data to then estimate what that boundary could be based on kind of the bounds of that system. Or they use model boundaries, and they use a two-step approach that I won't go into detail here, but they try and estimate the probability that a given region is served by any community water system as opposed to private wells, and then use that to then inform the probability that it's served by a particular nearby community water system. So that comprises the rest of the data, about 45% of these boundaries. But again, these are really important when we think about trying to standardize U.S. drinking water quality research, including environmental justice research. And they also may benefit kind of other related disciplines. So environmental epidemiology research, when you're thinking about the geospatial or analytical scale of the data that you're analyzing, when you want to link population data with drinking water quality data. So I'm showing there a figure from a paper where you can think of these external exposures, maybe in this case, drinking water quality, and then kind of the covariates that could be linking those external exposures with outcomes. And so these data can be important when you're thinking about building DAGs and working with environmental epidemiology data in that way. And so this really is the kicking off point for this sub-project in a way where we're trying to use these geospatial dasometric mapping approaches that I'll talk a little bit in more detail about to estimate service area boundary sociodemographic composition for all of the service area boundaries for SAB and US EPA's latest data. And then I try to assess how well these estimates can match reality, and more on this later because it's a little bit of a difficult question to answer. And so for this approach, I'm again using these geospatial dasometric mapping approaches. These can account for kind of small scale variations in population density, as opposed to some of the interpolation methods that I mentioned earlier. And so this method begins just with a single surface area boundary. So this is in blue. Again, these can have pretty strange features. They may not really follow a lot of boundaries and can be really irregular in terms of the shape. And so this approach is starting with that boundary and then using census level data on census tracts around the country to intersect with those regions. So then that forms this intersecting region in purple, or then you can use some of the census data to inform the population that that system is serving within these overlapping regions. And one note here, it's particularly important in the second set of information I'll talk, like a research project that I'll talk about, is that these can change over the years. Census tracts can change, more can be added, they can be removed or added together over time. And then using a pretty high resolution raster from Data for Good. This is kind of Meta, Facebook's population raster files that they have available now. We then estimate the population within these intersecting regions using that raster. And so it's really high resolution, but it allows us to get an estimate of the total number of people within all of these intersecting regions. And really, this is functioning like a weight for the third part of this, which is then constructing these weighted averages using the population estimated within that intersecting region, its value in terms of all these different demographic factors based on census tract level data. And then for each service area boundary, we're then constructing this average according to these population weights. And just one kind of thing to note is that this raster file is only available for 1 year. And so we're assuming that the weights that we're generating according to that raster file are applicable over a longer time frame. So just something to keep in mind. One other kind of caveat in this is that even though EPA has attempted to try and remove areas that are served by private wells, it's still very possible that there are residual areas served by private wells within these data, or maybe there's overlaps between populations who use private wells and populations who are served by public water systems. So a recent addition to this has been to also try and estimate the population served by private wells in these intersecting regions using USGS data, and then basically subtracting that out from each region to reconstruct that weight and then go through the weighted average process again. So I'll talk a little bit about findings from this as well. And then I talked a little bit about trying to assess the data quality of the estimates. Like, how do you can do all this, but how do you really know if the estimates are even accurate? And the difficult thing here is that utilities generally don't publish data on their customer composition. So there's not necessarily an independent data set that we can use to assess accuracy of this method, at least that I'm aware of. If you do know, let me know. I'd be really curious to know about that. So the workaround currently is to use an analyze agreement between the estimated population that I just talked about by those methods and the reported population from the system in US EPA administrative data. And so this ranges from simple comparisons, just using, Spearman correlation coefficients, simple linear regression, and then looking at the slope and intercept. But noting at the same time, populations can vary pretty wildly for public water systems. You may have some that serve just dozens of people up to some that serve millions of people in certain cases. And you also may be curious about how well this agrees at different parts of this distribution. So both at the low end in terms of population as well as at the really high end. And so to try and account for that, I'm also trying to assess differences across the distribution. And so using quantile regressions at various percentiles, these differing from linear regression in that they are minimizing the sum of absolute deviations here. So this is done at different quantiles and comparing the reported and estimated, and I'll talk a bit about these details. And then again, analyzing both the slope and the intercept to assess how well estimated population may match the reported total population. So I'm going to dive into some of the details here for showing just EPA's map. And the most recent data product from the EPA has all of the contiguous US, Alaska and Hawaii, as well as Puerto Rico recently added. Again, comprising mostly known boundaries provided by the state or utility, as well as modeled boundaries in other cases. So those are in blue. Many of them are a little hard to see, but these are in blue here. And these approaches so far have estimated 268 to 279 million people within these boundaries. And if you compare that just to the total reported by all of these systems, it's about 84 to 87%. That range being because in one case, I'm trying to subtract out potentially the residual private well populations within these boundaries. And so I found using these methods, there's still an estimated 11.5 million private well users that are located within these boundaries that EPA has compiled. And so far, in terms of demographic indicators, it's included a range of racial and ethnic compositional factors, several different indicators related to socioeconomic status at the area level, age composition, gender composition, as well as in this case, we have this raster-derived population and population density as well. I'm just showing what these estimates look like in terms of estimated population in all of these intersecting regions. For the Cleveland area, this is kind of the big system in the Cleveland area, as well as many of the neighboring smaller systems around there. And in this particular case, about 95% of the total reported population from these systems is accounted for according to this method. And overall, reported populations were estimated pretty well. So this is showing just some of the simpler comparisons. On the left, just a simple linear regression, and then on the right, I'm detailing some of the Spearman rank order correlation coefficients. There's pretty good agreement in general with some evidence of undercounting. You can see the slope here is a little bit larger than 1, meaning that I'm kind of scaling up the estimated population to find what the reported population is. And then we see pretty good rank order correlation as well, 0.85 overall. We get pretty similar results when we account for private well populations. But because the population is lower there, the intercept gets a little larger, meaning that, again, there's evidence of undercounting, but we actually get an improved R squared. And one interesting thing to note, I think this really speaks to the utility of these known surface area boundaries that EPA has compiled, is that when you just restrict to systems that have known surface area boundaries, the Spearman correlation goes up to 0.92, and you get a better fit between estimated and reported population. So really speaking to the value in having known surface area boundaries as opposed to modeled surface area boundaries. And then one other little thing to note, you may see this kind of outlier here in terms of having an estimated population close to 2 million people, but the reported population is 0. And so there's other clear errors in the data. This is actually a pretty large system in California. So it's possible the true agreement between estimated and kind of the real population could be better than what's shown here as well. And I'm going to show just some of the quantile regression results, again, comparing known and estimated population with different parts of the distribution of reported population served. And so you can see in this plot, I'm showing these slopes for those regressions at various quantiles, where I'm going from the 5th percentile up to 95th percentile. Some of this really corroborating what we've seen as a whole. We see overestimated total populations actually at the lower end when population is lower. So those coefficients are below 1, but we see underestimated population when we're going up to the higher end. And so this is probably driving some of the results we saw just across the linear regressions. And in general, pretty similar results, accounting or not accounting for private wells. So those didn't necessarily impact our results greatly in this process. So before I move on to the next set of work, I want to just summarize what this project has done. It has used geospatial methods to estimate sociodemographic composition for 44,000 US community water systems. I think given the strengths of this method, it's likely superior to using aerial interpolation or population-weighted interpolation in some cases, just because it's able to account for these smaller scale variations in population density. And we see pretty good agreement in general, worse at the tails of the distribution, some potential benefits to using known surface area boundaries. And so there's a lot of benefit, I think, in the future to improvements in these surface area boundaries on the part of EPA. Ongoing work and some of this also future work could be to assess agreement with customer demographic surveys. If a small number of systems have those available, and then just comparing different geospatial methods to estimate population and demographic composition, whether we see pretty different results in choosing a different approach. And really future directions and plans for this are to release code behind these analyses and methods, as well as just the data for other researchers and the public to use if they're interested. Now I'm going to change gears. I'm going to talk about this ongoing project with a few other collaborators where we're analyzing sociodemographic barriers to advancements in water treatment among US community water systems. So this is actually a use case of those data that I just talked about earlier. And I'll talk about how these are used and then comparisons to another analytic approach throughout this analysis. But stepping back a little bit and talking about drinking water quality research and environmental disparities in drinking water quality in general, it's been theorized and discussed previously and throughout many case studies that inadequate infrastructure can very well contribute to drinking water quality disparities. Although interestingly enough, when you see individual studies out there, especially studies at larger spatial scales, most tend to use finished water quality as the outcome that they're analyzing. And so here I'm showing a graphic from a review of drinking water quality environmental disparities research, where kind of the breadth of the research is analyzed and then discussed in terms of outcomes and then kind of the variables that they consider. And it does find that finished water quality tends to be the outcome, although when you think about um, the things giving rise to drinking water quality, they may not necessarily tell you the full story. I mean, the other underlying operational, physical, or regulatory aspects of water infrastructure that are important to think about when you think about water quality at the tap. And so this figure is showing how these different factors relate to one another within the water system, where you have the physical infrastructure guiding the treatment works, distribution to customers, and then storage along the distribution system. You also can have management factors, of course, and operational day-to-day factors that impact drinking water quality, even the information about water quality that I asked about earlier. And then when you're thinking about specific drinking water contaminants, there's already some evidence available out there that differences in household level costs may occur across different systems just due to differences in the costs of system level treatment. And so on the left here is a figure from a pretty recent paper analyzing costs currently for a bunch of systems in Ohio under kind of system as it is, and then additional yearly costs expected for these systems due to PFAS treatment. So these are the median costs across different sizes of systems, and so these vary based on the populations that they serve and how large that population is. And so you see here houses served by very small systems currently are already paying the most and would experience a greater increase in costs. Some of that being expected, of course, to economies of scale. So they have to spread out that cost over a smaller population as opposed to, a very large system where they have to do that over a much larger population base. When you think about costs as a whole, EPA's estimated the cost to treat PFAS in drinking water nationwide to be $1.5 billion per year. I think 98% of that stemming from just investments in treatment, with kind of the remaining 2% being testing and other kinds of sources of costs. And then higher estimates coming from the American Water Works Association, up to $3.2 billion per year. So this specific research project has two main goals. The first to assess whether water system characteristics like water system size, as I just mentioned, are associated with advancements in water treatment among water systems in the US. And the second, bringing in a lot of data from the first set of slides I talked about, whether sociodemographic composition of those communities being served by those systems are associated with advancements in those treatment processes. So the data and study design are detailed a little bit here. This is using US EPA treatment process records, these being historical records on treatment processes and objectives for public water systems. The research in general here is focused on community water systems, and so these are a subset of public water systems. You can think of them as. And the records for each facility managed by public water systems from 2004 to 2022 were available. EPA keeps the last 10 years available online. And so we submitted for this project and for some other work, a Freedom of Information Act request to get earlier records from EPA. And the key event under study here that I'll detail a bit more how this is being analyzed is the reported use of reverse osmosis, ion exchange, or activated carbon for at least one facility managed by a community water system. And so importantly, these go beyond just conventional treatment processes that you see in most systems like sedimentation or filtration or flocculation or disinfection, fluorination, things like that. But really chosen because they were effective for a range of emerging contaminants, including PFAS. And so that's why they were selected as the event here. And in terms of the data and study design. Just for some additional details, I'm joining these treatment records with Safe Drinking Water Information System data. This is a database that EPA manages that has all sorts of information on the population that the system serves, so source water type, whether that's groundwater or surface water, for example, the ownership type, private versus public ownership of that system, the regions that the system is serving. You can also get violations data from that database, and as well as American Community Survey estimates, the census data on the counties served by that system, the demographic composition that system has, or a pretty wide range of demographic indicators. And then here we're also bringing in some of the service area boundary data that I'll show on the next slide. So really throughout this analysis, we use both that county level analysis kind of as the baseline, kind of what typically studies approach this analysis for, and also the most widely available nationwide. But as I talked about before, we also use these service area boundary estimates according to that method I discussed on the first set of slides. In terms of our analysis, because we have these data available over time, we chose to do this analysis using discrete time to event methods. The first set of analyses analyzing how quickly different groups of systems have reported advancements in treatment processes. So these stemming from a bunch of the different categorical indicators that I mentioned earlier. And then a range of adjusted analyses that aim to assess adjusted associations between demographic composition and reporting these events in terms of advancements in water treatment processes. And this additional detail, this uses a staggered entry design. So it shifts from the calendar year onto just years elapsed since the data were available from the systems. I'll detail just briefly how the model actually looks in terms of just the form. So on the left, we have the probability that a system is reporting advancements in its treatment processes within a given year from a different given division, a given census division, and for a given system. On the right, we have a range of different racial, ethnic, compositional factors, these really being some of the focus of these adjusted analyses, as well as median income being in the primary model. And we assess how these associations differ for a range of different socioeconomic status indicators. And then we know from a variety of studies that there are potential confounders that we should consider in this adjusted model. Some of these being the focus of the Kaplan-Meier analyses that I mentioned, like system size, where those systems are located around the country in terms of different regions, changes over time that also can affect just the probability of reporting treatment over time, as well as several additional confounders or potential confounders. So ownership type, population density, source water type, and whether or not the system has a prior contaminant level violation. So these are regulated contaminants that systems report violations on to the EPA. And we do a range of stratified analyses here. On the left, I'm first just detailing the main analyses at the county level with sociodemographic composition available at the county level for around 37,000 community water systems nationwide. And then doing that again at the service area boundary level for a little bit of a smaller set of systems just due to available data from the EPA. But we were interested whether, particularly for a set of piecewise logistic models, whether those demographic associations vary according to system size, for example. So very large systems serving over 10,000 people, all the way down to small and very small systems serving less than 3.3 thousand. Whether that varies according to urbanicity, so more urban systems versus more rural systems, whether we see differences when we look at different census regions around the country, and then just some select additional analysis that I think I show on the next few slides. Focusing on systems that have had MCL violations before the study period began, systems that didn't report making substantial water source protection measures, kind of with the thought that these systems may be more susceptible to drinking water quality issues. And then we also look specifically at systems with known PFAS detections across 3 different monitoring data sets. So I'll start showing some of the results from this project, starting with some of the Kaplan-Meier results, starting with population size here. So first I'm showing over time. On the x-axis, you see the years elapsed since year 0. On the y-axis, you see the cumulative likelihood of adoption of treatment processes. So as that number is increasing, more and more systems within this group have reported adopting these treatment processes. And so for very large systems serving over 100,000 people, by the end of the study period, they're getting just above 0.3 in terms of cumulative likelihood. And then here you see compared to large and medium, small, and very small systems, they are much more likely to have reported these advancements. And so in fact, they're 7 times greater than small and very small systems. And I want to move on just to some of the unadjusted analyses in terms of sociodemographic composition. So here I'm showing for % Black, % people of color, and % white residents served by systems, breaking these into quartiles. So quartile 4 is in red, and quartile 1 is in orange. And generally, we're seeing kind of the same set of plots shown earlier that for % Black, quartile 1 being more likely over time to have reported advancements in these treatment processes just based on the cumulative likelihoods, so kind of quantifying the incurred incidence of reporting advancements over time. A similar story is seen here for % people of color, and the reverse for % white, where quartile 1 is less likely than quartile 4. So generally, systems serving greater % Black and % people of color were less likely to report adoption of these treatment processes over time. And in the adjusted analyses, so again, this is from the piecewise logistic models, we generally see a pretty similar finding. In the main models, both at the county and surface area boundary scale, so in the solid line and then the dashed line, an increase in Black residents by 10 percentage points, associated with a 14 to 19% decrease in the odds of reporting adoption of these treatment processes over time in the main analyses. You see pretty similar results when you look across different strata and different subgroups of the primary set of systems. So generally similar results when you look across different system sizes. Potentially some differences looking from urban and rural systems, where urban systems, there is some overlap just with null there, but generally a negative coefficient estimate amongst both sets of systems. Similar results for systems that have had a prior violation, and also for systems that have had known PFAS detections over this time period. I won't show all of these results just in detail for the presentation, but we actually see across both spatial scales that these differences in terms of adoption of these treatment processes was most prominent amongst systems in the southern US. So amongst this region, we generally see a larger decrease in the odds for the % of Black residents served by systems within this geographic region. And I think I do have some supplemental slides if you're interested on other details from this study, but associations with additional people of color groups generally not observed with some variation by system size. And so in some cases, we do see a difference. In some cases, we don't, just according to the system size of those groups of systems. And then for median income, just from the main analysis, we see In some certain cases, associations that vary by system size and can be nonlinear in some cases as well. And just in this last figure, I'm kind of combining a set of the stratified models with the results for percentage of Black residents that are served by these systems. So on the left, on the right, you can see on the x-axis, I think this is actually particular to systems in the South, systems serving up to a little around 0% Black residents to close to 80%. And I'm showing the predicted probabilities of treatment for these different system size groups. And so for very large systems, for groups towards the end, in terms of percent Black residents served, they have about a 10% predicted probability for these groups of systems, and that going down to 2% as that increases to close to 80%. In contrast, you see for very small systems, they tend to remain below 1% in terms of their predicted probabilities. So that really speaking to some of the magnitude of the results according to system size, as opposed to some of these differences in terms of demographic composition, for example. So in conclusion, I just want to summarize that we found that system size was pretty strongly associated with advancements in water treatment. We think a lot of that owing to the high costs and economies of scale for these particular sets of treatment technologies, and also just a large variation in terms of technical and managerial capacity that systems may have. Some systems having full sets of staff who can manage water treatment processes, and then some being much smaller and not necessarily having the capacity to adopt these advancements. And we also do see racial, ethnic, and in some cases socioeconomic disparities. I think some of that being important when you then consider kind of the breadth of research out there that focuses on specific contaminants and then finds similar findings in terms of demographic disparities across systems. And these methods that were used here, I think, are really useful in the future for identifying systems that are likely to require support as regulatory requirements change. So thinking of PFAS in particular, as remediation plans begin to be developed or support for systems is made available from the federal government as well as from states. It's important to think about which systems may be struggling in terms of making changes to their water treatment as necessary. And here as well, we think based on these results that they suggest that policy changes supporting water treatment and infrastructural development really in small and marginalized groups are needed and should be developed and kind of fleshed out in more detail than they're currently made available. And here we have a preprint to read as well on the right if you want to scan. So I'll leave this up just for a few seconds before I move on to the next slide. And so, as I mentioned, this third part in this presentation, I want to zoom out a little bit and talk about the availability of drinking water quality data in the US as a whole, and then a recent perspective piece by a few other collaborators and I on trying to kind of lay out the blueprint on how these data could be unified and then kind of what aims they could serve in terms of having the data available. And of course, as many of you know, currently we're seeing a lot of hostility towards environmental justice research programs and support in terms of action. So here I'm showing just a few of the recent developments over the last year, seeing ends to environmental justice programs and monitoring tools like EJ-Screen. The White House environmental justice page now being completely unfound. These fights over infrastructural money that were made under the Biden administration, particularly for PFAS as one example, as well as for lead pipe replacements. And then kind of even earlier actions by the federal government in terms of this environmental justice order from the Clinton era being scrapped under the recent administration. And so these changes, as well as kind of some of the roots of the modern environmental justice movement in the US, and the fact that they extend pretty far beyond the federal government, kind of shaped how we thought about this perspective, and then kind of the main points that we wanted to highlight. And so going back in history just a little bit, I'm sure as many of you know, in the early 80s, in terms of the modern environmental justice movement in the US, this stemming originally from protests in Warren County, North Carolina, over the dumping of PCB contaminated soil in a predominantly Black county in North Carolina. It led to a range of fierce, place-based protests and organizing and civil disobedience to fight back against the siting of that PCB contaminated landfill. That was pretty closely followed by some studies by researchers like Robert Bullard and the United Commission Price on this toxic waste and race report that they released in the late 80s, early 90s, documenting disparities in terms of where hazardous waste facilities are located nationally. So that being really the root of these quantitative analyses of environmental disparities and environmental injustice. And then in 1992, actually under the Bush administration, we see this now in terms of research gaining attention from the federal government, with the EPA releasing this environmental equity report on reducing risks for all communities, where they do their own analysis and come to many of the same conclusions as those prior reports. And so in this particular perspective that we have available, and I'll show, I think, a QR code later on if you want to read it in more depth, we're really curious as researchers, and specifically as a group of quantitative researchers who do work related to these topics, what we can kind of do as federal attention at the regulatory level has really waned on a lot of these issues, just even over the past year. And so we envision kind of a blueprint for what a unified database on drinking water quality would be in the US. And that perspective is broken down into three parts. I'll detail really quickly. The first focusing on metadata on customers and treatment infrastructure, linking that with existing drinking water quality data sets, and then seeing and kind of proposing how machine learning tools that are used currently, as well as maybe in the future, AI could be used to inform the availability and action on drinking water quality. And so I'll go quickly through this. I think I'm running a little late on time, but one kind of main problem that I didn't talk as much in depth throughout the presentation is that existing drinking water quality data in the US are pretty scattered, or they're incomplete, or they're difficult to access. So they may not necessarily have all of the information that you need to properly interpret them. And so our proposal here was to improve transparency and availability of drinking water monitoring data, compiling existing data sets available from the EPA nationwide, as well as throughout different state databases that I have worked on throughout my research, filing them in a fair, principled way, and including continuous data when possible, which have actually been a pretty difficult thing to do, drinking water quality data in the past, along with kind of data on the analytical methods that have been used to analyze those samples, for example. Then longer term, we're really interested as trying to incorporate private well monitoring data, which have been made available by certain states in some cases. And then another problem is that there are a lot of metadata on drinking water quality that have been pretty untapped to use upon throughout different studies over time. And so our proposal is to use and really incorporate those data into any database that would be compiling drinking water quality data at such a scale. And so that can be in terms of developing resolve layers on demographic composition, of course, what I talked about earlier, for service communities, linking existing infrastructural data that EPA has. So not just the treatment data that I mentioned earlier, but also other EPA data that's available. And then even linking, more recently released infrastructural data. So a lot of that I'm stemming from many of the lead service line replacements. So information on the distribution system, for example. And then last, we were curious to think about current uses of machine learning and AI throughout drinking water quality research and how those can be extended or improved. And so drinking water quality data typically lag behind other exposure sources like air pollution in terms of being able to address research and community concerns. A lot of that and how these systems are able to incorporate specifically machine learning and predicting drinking water quality or air quality over regions that don't have data available. And so our approach and kind of proposal here is to make some further advancements in the use of machine learning to predict drinking water quality contamination over larger scales where you don't necessarily have sample data available. To use when possible these tools to automate data processing, especially when these are coming from disparate sources. So potentially thinking about the role that AI can be used in that specific use case. And I think longer term thinking across disciplines, so not just as environmental health researchers, but for community members as well as for researchers who are more kind of steeped in the uses of AI to think about how and if AI tools can responsibly inform communities about water quality. So I'm going to leave just QR code if you're interested in reading that paper in more depth. It's also available on PubMed, open access if you want to read it, if you're not able to read it via that link. And then last, just to leave some time, I'll go really quickly through a thank you. I want to thank, of course, the organizers of the Swetland Seminars for inviting me to this. I want to thank my previous and current lab from Harvard as well as at GW. I also want to thank the state agencies and EPA for providing data that I've analyzed throughout this work, other professors that I've worked with in the past, and then my funding sources that have supported me and collaborators on these different projects. And then last, I'll just leave my contact information there. You can reach out if you want to talk about research or need access to a paper. I'm also sharing my website there if you want to go there, or on my handle on Blue Sky. Yeah, and so I'm ready to take questions if hopefully there's still time to do so. But thanks you all for listening.
Thanks so much, Dr. Liddie. I do see a couple of questions here in the chat. Let's see. Owusu had shared, I'm interested in the geospatial method you use to create sociodemographic data for community water systems. There seems to be opportunities to use that approach to create sociodemographic data for different spatial units. What conditions must exist for transferability of this approach to other spatial units, such as neighborhoods?
Yeah, that's an interesting question. I don't know. Yeah, I'm not sure if the question is specific to kind of surface area boundaries or surface communities from water systems, or for other kinds of geospatial data that maybe don't pertain to drinking water quality. I think we didn't invent this geospatial approach. It has been used for other kinds of problems out there. So I think as long as you have, kind of a more high resolution population data or kind of land use data, and then you have the specific boundaries that you want to work with, you typically can adapt that method for that purpose. So it does depend on kind of how you are able to capture variations in population density or land use, and then having, the boundary that you want to work with as well.
Great, thank you.
Mhm.
I also see Francisca had asked, I was wondering if some of the effects of racism are blocked when controlling for size of the water utility, as there is a link with historical racism.
That's an interesting question. And I will say, let me move back to that slide somewhere in here, that we kind of do this dual-pronged approach on purpose, where we look at completely unadjusted analyses as well as these adjusted analyses, because these are important when you just want to think about, are there disparities between systems, regardless of the pathway or potential variables linking those demographic indicators with the outcome. So we do that because there also may be differences according to these different potential confounders that we then consider in the adjusted analyses. I think that is a good question, that there is that inextricable link between some of these indicators. I think census regions also being an example, where you do have just differences across regions in terms of demographic composition, just at an average, but also differences in adoption of treatment processes across different regions. And so those are not necessarily easy to extract from one another, but kind of why we have both these unadjusted and adjusted analyses.
And we had one more question. Could you speak a bit about the cost of these improvements and other impediments to enacting them? As example, lowering PFAS levels of concern would likely force adoption of better practices, but it won't lower the cost, or at least in 2025 seems very unlikely.
Yeah, so going back, I just put this up just so you can see what some of the costs look like. It can be, a real significant investment for the particular treatment processes that tend to be effective for emerging contaminants. So for PFAS, for example, they're not removed by conventional treatment processes. And so utilities tend to have to either change their source water, or change the mix of source water that they're getting their water from, or they have to make changes to their water treatment and adopt, in many cases, these pretty costly changes. So there's barriers in terms of size of the system, both being able to support, potentially increasing costs of water to their consumers by having taken on this cost in terms of treatment, as well as just, thinking managerially, and then in terms of staff who can operate these treatment processes. It does take a lot of skill to do. I need staff to be able to do that as well. And I think separately, there's an interesting thing to think about in terms of who should even really be paying. So for PFAS in particular, in some cases, systems are able to get remediation funds. It can be from the government, or it can be from potential polluters of their water source. So in some cases, if a system can make a case that their water source has been impacted by some kind of activity nearby, then they can use that to then pay for treatment. So that's not always easy to do, and it does vary a lot, I think, by state in terms of what kind of ownership a source can take on. So you both have to think about the costs of the system itself, and then staff, and then treatment infrastructure, as well as whether or not they can get external funds through lawsuits or through government funding.
Thank you so much, Dr. Liddie. Yeah, Tim shares the polluter should play a role. No, thank you so much for your presentation. We'll be sure to share all of the links that Dr. Liddie shared and his contact information with everybody who attended. And if you have any questions, feel free to reach out. Thank you all so much. Have a good day. Thank you.